Hi, I'm Megan, and my topic is coping strategies to support children in sexual abuse. So the problem. Children who face getting justice for abuse have to undergo a sexual abuse examination. The examination is intrusive and can add emotional distress on top of the trauma that is already there. People may not be knowledgeable on the importance of examination, and children may not be receiving appropriate preparation. There needs to be coping strategies set in place specific to developmental levels and ages. So the solution, providing coping strategies for children who undergo these examinations, which include infants, toddlers, preschoolers, school-agers, and adolescents. And the coping strategies will either be presented by a child specialist, who is someone who typically works in a hospital environment and works with pediatric patients from birth to 17, and they really help children understand what's going on with their bodies and help prep for procedures. Or it can be performed by the professional performing the exam. And the preparation will depend on the ages of the children. And examples are an informative video or therapeutic activity that helps prepare the child. So this is my first article, The Emotional Impact of the Medical Examination for Child Sexual Abuse. There have been questions regarding sexual abuse medical examinations. Some are worried that there are negative emotional responses from children who undergo these examinations because as of 1998, 25% of children have definitive findings, which is pretty low, so there are kind of negative opinions on these examinations already. And this article supports the idea that there needs to be better preparation for families as well as children, since anxiety and caregiver can heighten anxiety in children, and there really just isn't enough knowledge on the subject. So my second article is Triage and Referrals for Child Sexual Abuse Examinations from the Socio-Legal System. According to this article, there are only 127 programs in 38 states that provide sexual abuse medical examinations, and there seems to be limitations such as the number of people who can perform examinations and whether their expertise is dependable. Professionals recommend examinations, but there really isn't much about where to go or whom to go to. And medical examinations need to be reliable resources that are available, informative, and trusting. So my third article is Video Intervention for Child and Caregiver Distress Related to Child Sexual Abuse Medical Examination. So this article is about how researchers showed a prep video to some children before the children received the exam. And the children who watched the video reported less distress before and after the exam, and the families had a higher satisfaction. So I really liked this video intervention, and I have some more information on that. The first portion of the video was 15 minutes long and is for the caregiver without the presence of the child. It shared information about investigation process and shared techniques to manage own distress as well as child's. And then there's a 3-minute portion for parents of adolescents regarding developmental issues such as peer groups, substance abuse, and parental monitoring, as recommended for parents of 12 to 15-year-olds. And then there's a 5-minute additional video for caregiver and child to watch together. It would demonstrate medical exam procedures and then taught several coping strategies that children can use during and after exam. And all 100% of caregivers rated the videos helpful and that improved the exam experience. And some strategies were breathing techniques and relaxing tense muscles, which is great because it really does support why we need coping strategies such as breathing techniques to help children and families have better satisfaction before and after exams. So here's a little bit about sexual abuse examinations. Generally, the exam itself only requires a few minutes, but the history-taking and verbal preparation takes more time. So overall, 30 to 45 minutes are needed. An examiner must ask the child's permission and give a verbal explanation before the physical exam. And children who have been abused must be seen at once so biological evidence can be successfully secured, which is really important information. And the main purpose of physical exam is an assessment of the anogenital area. It is required that the entire body is examined, and there are 3 positions for the child to be in, which I have on the right, which is supine, knee chest, and lateral decipitous, which you can see are very vulnerable positions for children to be in. And then now they have a new standard which provides sliding, magnification, and high-quality documentation, which typically reduces the need for follow-up exam, which is said to be much less traumatizing to have a second follow-up exam. And then internal injuries are diagnosed by endoscopy, which is inserted a few inches into the anus, and cotton swabs may also be involved. So it is intrusive, and which is why we should have more preparation for children and strategies such as breathing techniques to help them. So the first part is having video intervention. I loved what the study did having the video intervention because it really helps children understand what's going to happen and the importance of it. So for infants specifically, infants can't be cognitively prepared for an exam, but proximity and visual stimulation can really make a difference, which I'll talk more about later. In toddler, there can be a verbal explanation, but at this stage, a therapeutic activity and presence can be the best option. And then for preschoolers, school age, and adolescents, a 5-minute video that describes sensory experience, so what they'll see, hear, smell, feel, and taste, such as here's the gown that you're going to wear, and here's who you'll see, who will help you, here's why it's important, and here's some sounds you might hear because of a machine, or you might smell some chemicals, and might feel a little cold in the room, and things like that are just really important to helping children understand what's going to happen to them without being blindsided into it. So coping strategies. For the infant, just being present and providing positive touch, such as just rubbing the arm and letting them hold your hand. Just keep talking to them, let them to know that you're there, and then try your best to cast your own anxiety away, as children can sense adults' anxiety, so just kind of maybe deep breathing for yourself. And then have a visually stimulating toy for the infant to look at, such as a light-up toy, or even like a little wand that can flip upside down for the child to look at. And then toddler, bringing a visually appealing toy is also good, still providing that positive touch. And reading a book, either a new one or one of their favorites, so that their attention can be focused on that. And just kind of talking through the experience with them during and after. And preschoolers, breathing deep breaths aloud with them can really help, and it could even help yourself, just breathing deeply, and then providing a book for them as well. Also, having a book that has more of a sensory experience, so things that they can touch, can also be really helpful. And then giving them a chance to talk about the experience afterwards. And school age, breathing techniques will really help, which can also help relax tense muscles, such as having them maybe clench their hands into a fist or clenching their toes and then holding it and then just letting it go. And then also guided imagery. Guided imagery is something you can study to really learn more about, but you can just have it simplified. So something as simple as saying, okay, close your eyes and picture your favorite place. And if they say the beach, you can say, all right, like what does the sand feel like? Tell me what you smell and things that you hear. And then discussing the experience afterwards when he or she is ready. And the same thing for adolescents, really making sure to discuss afterwards what they're feeling, because a stress for adolescents is really body image, and this may be really uncomfortable for them. Just making sure they can talk about what they felt. And here is the handout that I made. On the left side, the title's on the right, and then having a quote, and then sharing some information about the examination, and then pointing out the problem, solution, coping strategies, and video interventions. Just kind of putting some simplified information out there for them. And here are my references, and that is it. Thank you so much for listening.